Hi, I'm Dr. Jessica Mansfield, and today we're going to talk about grinding your teeth, which in dentistry we call bruxism. And grinding your teeth is something that's very, very common. Almost everybody grinds their teeth to some extent, especially at night while we're dreaming. It's one of the body's natural ways to release stress, just like dreams. But some people, about 20%, will do it to the point where they get really bad effects on their teeth, really worn down. And when I say really worn down, you can wear your teeth down to the point where you really can't chew on them very well anymore. And I've had multiple patients wear their teeth down to the point where they've exposed nerves, and then you need a root canal. And we do not want you to have to do that. Now, the good news is that there are some very simple things we can do to stop that wear from occurring, or at least minimize it and slow it down. And one of those things is using a night guard. And this is an example of a night guard. And it's just a piece of acrylic. And it's custom made to the shape of your teeth and mouth. And you put it in and wear it at night while you're sleeping. And it's balanced so that when your bottom teeth grind onto it, the bottom teeth are all balanced and you cannot grind just one tooth or another. Now, most people's favorite way to grind teeth is to find just one spot and go to town on it. And I myself am a very bad grinder. And my favorite position, if I don't have a guard in, is to do this. And that tooth up there, I would wake up in the morning and it would be sore. So I made myself a night guard. And the difference is phenomenal. I can tell you from personal experience, and I can tell you from the experience of my other patients, that you do not get the pain, and the sensitivity on your teeth dramatically drops once you start wearing a night guard, because you're not putting these tremendous clenching and grinding forces on your teeth on a daily basis. Now, when we chew, our teeth, of course, touch and we grind and we touch and we grind and we go chew, 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 but it's just for a moment, chew, chew. When we clench and grind, and we don't let go. So the duration of the teeth together is much longer, and the forces that we use to clench are 7 to 10 times the amount of forces of when we chew. And that's why it can be so damaging to the teeth. And some people will also get jaw pain from the clenching and grinding as well. So the night guard will protect the teeth from excessive wear while you're wearing it at night. It will also balance the bite and take pressure off of the jaw. And that works for the majority of patients. Probably 60 to 70% of patients get a very good result from the simple night guard. Not everybody, and there are other things we can do to help those people. And the first step, though, is always something simple like the night guard. Now, I will have my patients, if they have not gotten care soon enough to prevent a lot of wear, and they've needed to rebuild their teeth in their whole mouth to build up the teeth again from all that wear, which we call a full mouth rehabilitation. We then get them into a night guard to protect their teeth and to protect all the crowns and all the work that they had to have done, so that that's the one and only time that they have to do all that work. We want to protect that work and protect their teeth, make sure their jaws stay balanced and comfortable, and so they don't have to do that ever again. So the goal with them is that the crowns that they've had done now are going to last the rest of their lives, and they will just need cleanings. And that takes regular maintenance and care, just like maintaining your car. If you want your car to last, you got to change the oil and do the regular maintenance on it. You got to take care of yourself and your mouth in order to have everything last in your mouth. Now, some patients, even though they get the night guard, they still feel like their muscles in their jaw and their face are just always very tight and almost sore. Some people will be actually sore to the touch because their muscles are so overworked by it. And a good therapy for that is Botox. Botox will go in. We just do some injections into the muscles on the side, and that will help to reduce the strength of those muscles so that they can't clench as hard. And my patients who have had that done really like that therapy. They will always come back for more to have it done. Now, they have to get more because Botox lasts about 3 months, and then it wears off and you have to do it again. But it's very, very simple and virtually painless because it is such a small needle and such a small dose. And the areas here, not sensitive very. So my patients have really not felt it much. The muscles of the jaw, just like if you were working out at the gym and you want to increase the strength of your bicep and you lift weights and you work the muscle and your bicep gets bigger and bigger. Well, these muscles in the face, if you're clenching a lot, those muscles are going to get bigger and bigger. And some people will get a very square shape to their face as these muscles get bigger and bigger. So Botox will not only help the muscles relax and they can feel better, not feel as tense. That can help reduce headaches in this area, as well as just not being sore muscles. But continued use of Botox will help to slim those muscles down, and you can get more of a heart-shaped face, heart shape back to your face, and get rid of the squareness to those muscles because you're not working those muscles out as hard and building up those muscles. So if you think that a night guard or Botox might be something that is good for you, then I highly encourage you to give us a call and schedule a consultation so we can see what is right for you.